Namaste and good morning to all. And what an amazing session it was. So here we come for one of the key session of BICON 2025, and it is to highlight how evidence-based research drives advocacy, informs systematic care reform, and ensure sustainable changes for children in distress and without parental care. As so many care experienced youth yesterday and in today's morning talked about the lack of data, identity, and evidence, here we are deliberating on how evidence drive care reform. This session will emphasize innovative approaches to data collection, technology use, and translating evidence into policy and practices. So may I request on the stage our esteemed panel member, Mr. Prabhat Kumar, Ms. Khadijah, Dr. Gurneet. And one of the esteemed panel member is with us online, virtually. So the first panel member, Ms. Andhita Nurul, is a clinical child and development psychologist and lecturer from one of the STEAM University of Indonesia. Her academic work focuses on cognitive and neuroscience-based study, child and adolescent development, and family dynamics. Her research on key drivers contributing to child-parent separation explore parenting stress, mindful parenting, bullying, working mothers' well-being, and child welfare in collaboration with SOS Village International. So let's start her video.
Hello, good day everyone. Greetings for all colleagues, fellow researcher, and all respected participant here. I'm Andhita. I came from Indonesia, from Universitas Islam Bandung. So today I would like to share my research with SOS International and Universitas Islam Bandung about the key drivers contributing to child-parent separation. So let me share my presentation first here. Okay, key drivers contributing to child-parent separation. So let me explain first about the backgrounds. Here's the research backgrounds. It was a collaboration research between SOS Children's Village International and Universitas Islam Bandung Indonesia. And as we know, I will introduce the background of this research. Is about Indonesia has marked with socioeconomic disparities, a deeply embedded patriarchal culture, and highly diverse socio-ecological environment that shapes family life in unique ways. The drivers of separation in Indonesia are multidimensional and intersect with broader social, economic, and cultural determinants. We call it as poverty, violence in families and communities, limited access to education, and gaps in social protection mechanism. So, this research reminds us that behind every number or statistic, there are children's voices, each one with a story about safety, belonging, and hope. It's not only about poverty, it's not only about violence in a family, it's about the children's voice also. Therefore, in our study, we not only look at the data but also listen carefully to the children, young people, and family members because sustainable solution must begin from their lived experience. So this research consists with some question. We doing it with participatory work. So here's some research question we asked to the children and young people. What makes children, young people, what makes you as a participant in this family happy when they are at home, when you are at home, focusing on a house family drawn by participant and which they deem to be typical of those within their local community. The second is what makes you people, you children and young people in this family worried or unhappy when you are at home. Third, what makes the adults in the family feel happy, strong, and united when they are at home. And fourth, what makes the adults in the family feel worried or unhappy when they are at home. And last, this is question, very important. What is needed to help families be happy, strong, and united? So we only and 59 participants were engaged into the two research sites representing urban and semi-rural contexts. We also interview professional from government and non-government organization to better understand about the institutional perspective. In this research, we involving children, including children with disabilities, young people, including caregivers from the alternative care, adult family members, and also interview and survey with professionals across government and non-government organization. This multi-voice approach allows us to see not only what is happening within the families, but also around them. So how community system and social structures either support or weaken the family unity. So it's important to ask everything. Here's the dynamic factors as we find from this research in Indonesia situation. Is triangulation of data from children, young people, family members, professional, and report source during the test review. So let me explain one by one of the picture as you see in the screen. It consists of 5 columns. The first, second, and the third is the factors that we found in the previous research. And the fourth and last column, it's the findings from this research. The fourth column is associated circumstance in Indonesia. Consists of parental death, disability, single parent, remarriage, violence, neglect, and child protection concern. And as you see in the fifth column is about decision making within the child protection system. As you see, parental death, it's influenced the placement due to orphanhood, disability also contribute to abandonment and relinquishment, single parent, remarriage contributed to relinquishment, violence to the abandonment, removal from parents, child protection, and neglect contribute to the removal from parents. And everything in the placement due to orphanhood, abandonment, relinquishment, and removal from parents contribute to children to move to the alternative care. Description of our research result. As you see on the screen, it consists of 2 big findings. First is the family level drivers, and the second one is societal level drivers. So in the family level drivers, one of the most striking findings from our study concern is the presence of violence within the home. And the second one is intergenerational transmission of violence and poor parenting practice. We find that children who witness violence are more likely to repeat similar behaviors as adults. I think it's like a bad cycle that weakens emotional attachment and perpetuates family dysfunction. In this context, parenting support becomes critical. The third, as we see, it's education. Education was viewed as essential for preparing children for responsible adulthood. Yet many still face barriers from economic costs to child labor and early marriage in Indonesia. Lastly, we found it as play and leisure. It's a very interesting findings in our result. Most of the children, mostly the young people, uh, said that simple yet powerful moments of connection, such as eating or spending time together as a family, it's very impactful for them and important to build in the family. These activities foster joy, unity, and emotional safety. So it's a very big foundation of family resilience. So it's a very important in our findings, one of the important findings. And as you see in the second column, societal level drivers, it's about multidimensional poverty. Indonesia is, and the second one is about labor migration. Mostly of the parents becoming to be labor migration. They work abroad uh, in Asia or many more country. So it makes children becoming go into the alternative care. And the last, weakness in the national child protection system. We have one, two, three, and seven findings, recommendations. Sorry, this is our recommendation. First is protection. Um, its protection is associated with violence mostly, but it's not only about the violence. It's urgent need to continue investment in violence prevention program for both adults and also the children. Programs in Indonesia are ongoing. We need more ongoing programs, more systematic and more sustainable. It's preferably for girls and women in particular must have better access to counseling and psychosocial support within safe and compassionate environment. So we can breaking the cycle of intergenerational violence, begin with providing care and not a punishment. And the second one, we find that adequate standard of living and well-being. It's about living standard and social protection. Indonesia has already has a range of social assistance system, but the family often face fragmented and uncoordinated service. So we need integrated, evidence-based, and family-centered approach that respond to the real and complex challenge family face. And shift in funding priorities from institutional care towards supporting families in poverty and social exclusion, but it must be targeted to the very important family who need it more than another family, maybe not really need the funding priorities. Okay. And the third is about the parenting support and breaking intergenerational cycles. It's about support with parenting. Many parents has own childhood trauma effect, and it's affect their capacity to provide nurturing care. So a program must include not only material support but also psychological and emotional guidance. Fourth, it's about inclusion of children with disability. As we know, we need more we need more support system that make children with disability included with all the social system, and education must be free for them also in Indonesia. Finally, it's about education, as I mentioned previously, and play and leisure should be not underestimated because it strengthens bonds and offer reliefs from daily stress. Last is about strengthening gatekeeping and child protection system from the government and not on and non-government institution, and also from stakeholders also. So after we talking about the results and recommendation from this research, I have a very important conclusion about this research. Our research is invite us to see family not as isolated units, but as a living system. So we need more empathy, more protection, and empowerment. It's very, very important for family in Indonesia. But every child deserves to grow up in a family that is strong, connected, and hopeful. So let uh, let's make this presentation. It's just not more data, but so this is the last slide. Let it be called into action. We cannot walking along this solution. So let's collaborate, innovate, and advocate, so that no child has no face separation when what they need most is a connection. Thank you so much for your attention. Hopefully we can meet each other soon. Have a nice day. Bye.
Thank you, Anandita, and what a lovely presentation of her. And she focused on what all the various dynamics or the factors that causes the family separation, its consequences. And I think one connection from the previous session also, where Shankar has highlighted about like the moment of joy when we all sit together, have food together, and how much it helps and lead to the family resilience thing. So I could just see the connection, the evidence starts building. So with this, our next 16 panel member is Mr. Prabhat Kumar, who is a seasoned child protection specialist from India with over 2 decades of experiences in child rights and family strengthening. He has worked with leading organizations including UNICEF. His practice lies in care reforms, safeguarding protocols, and gender transformating programming. Prabhat has significantly contributed to policy advocacy, partnership building, and workforce development in the child development sector. Deeply committed to safeguarding children and vulnerable groups, he continues to champion systematic and sustainable changes. So it's a great to hear you. Please, you want to do?
Okay, I'll try to speak from here. Mr. Ranjan said yesterday that he was under pressure because he had to speak after puja. And today we heard so many care levers, so you can understand. Thankfully, we had a mental health related session in between, which helped me to cope with my stress. So thank you. Very good afternoon. I'll just be speaking about give you some context of care reform related work that has happened in India, and I'll present 2 evidences as a firm believer of someone who believes that we have to inverse the pyramid. And when I say we have to inverse the pyramid, we have been talking about challenges after the harm has happened, okay, or children have slipped through some of the gaps in the system or at community level. So I am a firm believer of family strengthening, family preservation, someone who works on the prevention part. So one, I'll be talking about that evidence. And secondly, I also believe that everything costs money. So how will we have those money? So before coming to that, I have just 2 slides where I'll be presenting the context. Can we go to next slide, please? Okay, so some of the speakers from India have already given the context, but just to tell you that last decade there has been greater movement on promoting non-institutional or family-based alternative care in India, and earlier this was intent that was done mostly through the policies, but what is good that now it is translating into numbers and budgets. So if we just see the total number of children, like 170,000 children who are receiving sponsorship support, there is substantial increase even in the foster care intake, the aftercare support which is provided. So government provides support through services, and also there is amount allocated, which roughly comes to 550 US dollar per annum, which is given for sponsorship, foster care, or aftercare support. Uh, India came out with the foster care guidelines. And these guidelines through seminars, workshops were disseminated, and this guideline also paved the way for partially like having prospective adoptive parents also fostering child when they are into the waiting period. So that leverage was given. And then we have been speaking about the aftercare practices. There are certain things such as birth certificate, the health card, the unique identification card, and the CCI living certificate, which becomes important to have the future document. This came into the policy to practice. Next slide, please. Okay, all this was possible only because of greater convergence and collaboration between the civil society partners and government, UN organizations working together. So there are certain things which is happening in India. The focus was also on the coalition building, network building. We have been speaking about the partnerships. So there is India Alternative Care Network, which was set up by civil society organization. There is steering committee and working group that guides it. It plays role in creating the knowledge or knowledge products on alternative care. It works on dissemination of these knowledge and also gathering the evidences. So, and there are community of practice within this. So this is very actively working. We have roughly around 300 odd members across country who are proactively contributing to this. There is National Care Lever Network and Shankar, who is playing very important role in steering that. We also did the cohort of master trainers across 11 states who are practicing the transition tool. And this transition is not just about the reintegration of children, but the important focus is on how do we transit on the mindset, shift the mindset or shift the system so that the system changes their thinking towards from institutional care to alternative care. There have been development of master trainers in several states, but what is good is that these were earlier anecdotal, but now they are being institutionalized through state level institutions or at national level. There is institutionalization of these materials. What has also happened is there is greater converging and people coming together. So conferences, family summit, these events bring the stakeholders from government and civil society together so that they are able to contribute, learn from each other, because it's a vast country. So it's important that people learn from each other and then they apply those knowledge. Also engaging with the academia, social workforce has been an important element there. What was also good, and this is something Dorothy pointed out yesterday, and thanks to the CAFT initiative particularly, the focus on children with disability was very, very less and minimal. In last couple of years, that's something which has really picked up. Last year, in fact, the Supreme Court, which is federal court in India, also convened a special 2 days to bringing the stakeholders together to talk about where are children with disability in our juvenile justice system, which was a big step. There were also studies, evidences collected from the ground, so that's working quite well. And I think now it is time we are taking it into ground. There are some level of effort which are already being seen, but then much more needs to be done. And lastly, we have 12 state level networks, and also network of foster parents that has been piloted in one of the states in India. So this alliance, this working together between government and civil society organization actually has generated this result. Now I'll come to the core thing that I was supposed to speak on, two evidences. Can we go to next slide, please? Okay, these are two things. Like I said, the amount that is allocated for the sponsorship, foster care, aftercare, currently is same amount for every child. It's like universal, so that amount is fixed. We conducted a study with Menstrual on costing and budgeting. There were a lot of findings, but I'm just picking up one of the findings from that study, and this is recommendation we have also submitted to the Finance Commission. India is now working on how will these flagship schemes be implemented in next 5 years. So we have given this recommendation, and we have had very positive responses from whoever we have shared these recommendations with. That it is estimated that total, like this is in Indian rupee, 72,000, which roughly comes to 850 US dollar per child is needed, because children with disability need additional support. And I must also highlight very clearly, again, this is amount which is mentioned for any child with disability. This might be different from different type of disability for that children have, but we have proposed that instead of just 550, if it can be increased to 830, that has come out from this. Then the care, aid, medical support, those things are also needed. Those costs can be covered. So it will be a holistic support in itself. Second evidence, which is again, this might be like giving it in 5 minutes is a difficult task, because this requires a lot of background information. But in India, we have local self-governance at 3-tier level. The bottom level, which is at grassroots level, is what we call Panchayati Raj system. And this is one of the very effective systems in India. And why I'm telling, for 3 reasons. One, things get integrated there. Otherwise, people work with different departments. But when it comes to Gram Panchayat, the fund, functions, and functionaries, all three are reporting to Panchayat. So that's an area where the convergence takes place. And yesterday, when we were talking about the philanthropy session in one of workshop, when they had asked me to speak on with the panel on philanthropy, I had highlighted that I will talk about philanthropy, but I'll talk more from the demand side of philanthropy. So there is no dearth of money. If you see, we have been talking about costs. Where will cost come from? Imagine most of us who are working in organization, or even if we are a policy maker, to generate any amount, it takes a lot of energy. By working systematically with Panchayat and the local self-governance structure, there is policy provision that 5% of the entire money which is planned by this Gram Panchayat Development Plan, we call it, will be going for women and child related issues. And this will not cover the education and other things, which are different. This is just for safety, security, other aspects that the Gram Panchayats or the local self-governance structures decide. So this 5% is a huge amount and can act as prevention. So the steps that is done is that they work on their plan, and they talk about what are child protection risks or women related, because it is for women and children both. So they identify the child protection risk and use this money to create awareness or address those risks. And in just 2 districts in one of Eastern Indian state where Changing the Way We Care has piloted this, they have been able to mobilize roughly around almost 1 million GBP in these Gram Panchayat to be used for protecting children, or some of those work is related to addressing the risk of family separation. So looking at like this gives us evidence that if we work with Gram Panchayats, the resourcing problem can be solved, or at least resourcing problem can be addressed through this. Lastly, just three recommendations based on the context that I have given, and also when we spoke about the two evidences. One, all these things required a lot of follow-ups. A district in India is, again, very populous. Roughly, it has population between 2.5 million to some of larger district has population of around 5 million. So, and we have district level structures. So sub-district structures are not there. How, and this is again recommendation that has been going, if we need regular follow-up, the sub-district structure is essential, and how we can leverage not just panchayat, but also having a sub-district child protection functionary to be working in these places. Second, I've already highlighted the focus should be on prevention and developing the community-based structure or community-based mechanisms. And they play an important role in identifying the family which are at risk of being separated. So the PRI or in urban area, urban local bodies can also play a very important role there. Lastly, we have been speaking about the challenges of children with disability for, like I said, there has been evidence generated now. It is time that these get translated into the law, schemes, policies, the convergence or what do you say, the commonness, how different laws are understanding it in same manner. Capacity development initiatives should include, like if we look at the training material itself, sometimes as a social worker, they are not receiving those training on which is inclusive in nature, or where they are taught how, or where they are developed capacity on how to work with children with disability. Those needs to be created and generated. Secondly, addressing the needs of girls, boys, or young people, so both men and women, youths will be very important here because their needs are sometimes different. That's it. Thank you so much.
Thanks, Prabhat. You very well emphasized on national progress in India's care reform and how evidence has shifted narratives and influenced milestones. So now we have our next speaker, Ms. Khadijah, who is based in Singapore and is the founder of Asia Family Trust, Asia Family First, and a senior international consultant for international social service. With over 2 decades of experience across Asia, she specializes in child protection, alternative care, and care reform. She has co-authored The Philippines Towards Inclusive Care and contributed to the ICB Journal and ISS IRC newsletter. Khadijah has presented at the Better Care Network's international conferences, highlighted community-led and evidence-based approaches. Her expertise includes capacity building, policy development, program design, and research to strengthen families and social service system for vulnerable children. So let's hear her.
I'm going to start in the Philippines. It is estimated there are between 1.6 to 5.1 million children who are differently able. That's about 12% of the population. Approximately 1 in 10 children aged 2 to 17 experience some form of disability or functional difficulty. Selamat tengah hari, magandang hapon, and a very good afternoon to everyone. Now, sometime mid last year, myself, together with my colleagues from ISS General Secretariat Geneva and ISS Australia, had the opportunity to embark on a learning journey together with one of the highly regarded local NGO in Philippines, which is Novel Foundation, to conduct a study examining how children with disability who are separated or at risk of separation from their families are cared for. We basically looked at the continuum of care options, basically kinship care, foster care, residential settings, and also family reintegration. The study entitled The Philippines Towards Inclusive Care, Assessing and Enhancing Alternative Care for Children reminds us that evidence is not just numbers on a page. It is the lived realities of children, families, and communities. In Asia, if we want evidence to truly unlock reform, we must recognize that the solutions are already alive in our communities. We simply need to listen, acknowledge, and elevate those initiatives. Now, I want to start by saying this. Data alone doesn't create reform. People do. And please indulge me if you can repeat it together, if you want to go for lunch early. Data alone doesn't create reforms. People do. Evidence becomes powerful only when it is interpreted through local realities, shaped by community wisdom, and turned into collective action. We need to see evidence as just a tool, not the final goal. It helps us reveal hidden realities, perhaps stigma, gaps in services, as well as the resilience of families who continue to care for their children against all odds. But evidence can also be incomplete and misinterpreted. Often we face missing data, ethical concerns, and sometimes the risk of speaking about communities rather than with them. So while evidence helps us to see the problem, it's people who help us understand its meaning. The collaboration between ISS and Norville Foundation was instrumental in opening pathways to connect with a wide spectrum of local stakeholders, from local governments, civil societies, organizations, to parents association, foster carers, and even children themselves, which was critical to producing a meaningful, context-sensitive findings. Norville Foundation not only provided the on-the-ground knowledge, but also had the ground-level access and legitimacy to communities, caregivers, and service providers. They were the bridge in building that trust, navigate us through the local customs and norms, reconcile some of the contradiction we found, and guarded us against making any casual inference based on our own assumptions and understanding. Hence, we were able to include voices from the parents, caregivers, and the children, enhancing the richness of the study, illustrating how policies and service gaps play out in real life. Now, Diksha and Surya mentioned in the welcome speech the need to bring together evidence and lived experience, and the many peers who shared on the community-driven initiative yesterday. It is important that we see families, caregivers, care leavers, community leaders, and children themselves are not just beneficiaries. They are the experts in their own context. Their lived experience is evidence. When reform centers their voices, we often find more sustainable, locally owned solutions than imported from outside initiative. That's why participatory reform, ground-out initiatives where communities co-create, take ownership, leads to a longer lasting impact. Now, for example, in Philippines, we had the privilege of meeting one of the Parents Association, which has been established for 25 years. They have about 100 members, and basically also they have a membership fee. And that allowed the parents to have access to the services such as therapy and being trained. And the training is basically a curriculum that the parents themselves develop to support the children transition to mainstream education. What's more fascinating was that this Parents Association was also able to reach to one of the low-income informal urban settlement in Manila, in Baseco, despite the limited resources that they have. Another entity that we managed to, had the privilege to meet up was Las Pinas Persons with Disability Federation, Inc., and they has been established since 2009. They basically oversees 20 barangays, and I'm just put in context, there's actually about 42,000 odd barangays in Philippines. Imelda, correct me if I'm wrong. And basically they help children with mobility impairment to access to school or health centers or anywhere they need to be. They also collect disintegrated data, which means they know the type of disability that the children has, gender, the education and health status, etc., etc. But they've also, and I think that's the remarkable, being led by the very person with disability, they actually develop a booklet with 96 activities for parents to engage with their children based on their own childhood journey and life experience. Now, these are good practices born from context, and they need to be documented, celebrated, and scaled. If you only look for gaps, we miss the wisdom that already is present. Unlocking reforms means not just identifying what is broken, but also shining light on what is working. In Asia, relationship and respect for local wisdom matters deeply. I must tell you that some of the deepest conversation and deep insight that I gathered during the study mission was over a bowl of halo halo, and I think in Malaysia is the equivalent of cendol. In South Asia, peers in that sense, it would be the, what's that, gulab jamun? Yeah, and of course, in that sense, the long 3-4 hours ride, getting from one place to another place, in that sense, and having the interviews, in that sense, with the caregivers and children itself. Now, I think in entering that space and having that privilege, we as researchers and practitioners must also approach these communities as humble learners and partners, not experts with ready-made answers. We need to recognize this community voices is not just input, but evidence itself. Reform is not about transferring a model from one country to another, it's about co-creation. I think we keep on hearing this word co-creation, collaboration, and coming together in fusion. And by respecting the local wisdom, we unlock the many new possibilities that we could not have discovered on our own. We need to move beyond data collection to data connection. And how do we go that in sort of moving evidence into action? 3 pointers. Basically, we need to acknowledge and showcase what are existing good practices, not just highlight gaps. Second one is we engage communities and local partners as co-creators of reform, not just informants. And lastly, we adopt policies and programs to be the cultural and social fabric of the place, not a universal model. I'm going to end soon. Now, if there's one message in that sense that I would leave with you today, it is that evidence only unlocks reform when it is grounded in humility, co-creation, and respect for local wisdom. Data may give us the map, but community gives us the compass. If we engage as humble learners, listen and adapt, then reform will not just be implemented nor imported. It will be owned, sustained, and transformative. Terima kasih.
Thank you so much, Khadijah. And well said, data alone is not enough, and evidence must be interpreted in context and combined with local community knowledge. I just take 1 minute here, and I would like to share with you all the community knowledge experience of Udayan Care under the Fit Family Together project. And here we have one key component of the project, which is a stakeholder convergence and a stakeholder convergence meeting periodic, where we bring cases, difficult cases on families strengthening with all the stakeholders at the district level, and we find the solution through them. So the community knowledge and the relevance of it are very important when we talk about evidence. So with this, we go to our next speaker, Dr. Gurneet Kalra, who is a dedicated researcher and practitioner in the field, currently working with Udayan Care. In her role, she leads national and international research collaborations and advocacy initiatives. Dr. Kalra is also the administrator of the international journal, Institutionalized Children Exploration and Beyond, published with Sage Publication. She has authored multiple research papers and book chapters and has presented her work at global academics and professional forums. So over to you, Dr. Gurneet.
Thank you, Ranjana. So, good afternoon, everyone. So many things resonate with me, hearing everybody talking about evidence, talking about convergence, and how we bring everything together and create evidence. So, it's an honor to share my journey of building evidence with Udayan Care on family strengthening and alternative care in India and globally. This presentation reflects our commitment to research advocacy that centers children and youth. So from inception, Udayan Care has prioritized evidence-based approaches. We believe in a cyclical model where practice informs research, research drives advocacy, and advocacy loops back to improve our practices. Through this, we have identified gaps in the existing policies like those highlighted in one of the national level study, Beyond 18 on caregivers, influenced several decision-making through publications and strategic advocacy at national level, developed participatory tools like QNCC to assess the needs of children in care in culturally relevant ways, created several frameworks such as transition readiness framework for children who leave the care system, sphere of aftercare for care experienced youth, the circle of care and protection for family strengthening while working with the communities. With over 90 publications across journals and books and a monthly resource hub, we are committed to bridging knowledge across India, Asia, and around the world. We're also working continuously towards filling the critical gaps like the lack of longitudinal studies, the adult outcomes, limited data on disability-inclusive care reform, and the need for robust outcome tracking. So our ultimate aim is to ensure that every child and youth is seen, supported, and strengthened through data-driven systems. Our work has also contributed to global discourse. We have authored several chapters in international books, which are published by Routledge Publication, UN Book Series, and the upcoming one in January, which is with Oxford Publication. So these chapters explore social support for caregivers, access of higher education to care experienced youth, and the aftercare system in India. They are multidisciplinary, grounded in lived experiences, co-authored by care experienced youth, and offer comparative insights across several countries. So just to give you a brief, let's now turn to a national study exploring marriage among caregivers. So we've been talking about adult outcomes. So with a sample of around 55 married care experienced youth, we have examined how adverse childhood experiences shape the marital outcomes. What is the role of economic and social factors post-marriage? What are their perceptions of marriage and parenthood after their marriage? So some of the key findings we saw were, marriage is often seen as a safety net, a way to feel socially accepted and belong. Adverse childhood experiences continue to impact adult relationships and marriage outcomes. Transition readiness predicts and impacts emotional and marital outcomes. Gender dynamics and economic stress influence marriage stability. Many of them still face stigma and lack resource ownership and accommodation even post-marriage. So this study calls for a nuanced, trauma-informed care systems for caregivers who are navigating their own family life. We are now initiating a critical study on children and youth with disabilities and care in children and youth with disability in care homes and aftercare homes across 3 Indian states. So this research aims to document the lived experiences of the children and youth with disabilities in these homes, assess the transition readiness, the planning, and the available aftercare support. Also align the care practices with disability-inclusive legal frameworks. So some of the expected outcomes include improved collaboration of disability-inclusive legal provisions, better access to education, employment, and rehabilitation opportunities, increased independence and social reintegration, reduced long-term institutional dependence through effective transition planning. So here we are inviting partnerships to co-lead this transformative work with us. We've also been doing evidence generation through ICB, Institutionalized Children Explorations and Beyond, which is our biannual academic journal, which is published in partnership with Sage Publications. It's a global knowledge resource hub which has a global scope and is focused in Asia, And we have more than 29,000 downloads and a pool of more than 90 peer reviewers. This journal bridges the gap between policy, practice, and research, thereby amplifying the care experience voices and showcasing several innovative models. This journal is engaged with more than 270 authors from 20 countries over 1 decade. We have a strong editorial board of 18 members from 10 different countries. Guest editors from organizations like Hope and Homes for Children, SIRI, and Martin James Foundation have helped shape the regional discourses. Through this journal, we have documented several trends and created a regional platform for sharing discourses. We have brought together researchers, practitioners, and policymakers on the same platform to develop various dialogues. We have also amplified the voices of care experienced youth, enabling several organizations to showcase their best practices, innovative care models, and policy recommendations. So there is no reinventing the wheel. We've also influenced decision-making and standards of care by strengthening scientific inquiry across the globe. And the impact is evident through academic recognition at national and international level, the kind of practitioner engagement, and the global outreach and ownership. Some of our special issues reflect evolving priorities, ranging from child sexual abuse and deinstitutionalization to kinship care and disability inclusion. Each issue is rooted in evidence and shaped by practitioners' insight. So taking forward the recommendations, as Dr. Rinchan mentioned, we have had special issues of this journal, September 2024, which is a special issue on kinship care, and the September 2025, which is a special issue on family strengthening in partnership with Martin James Foundation. So this is the standard template of the journal. And in this, we have interviewed more than 20 experts from 16 countries. And we have had experts like Professor Adrian Van Breda, Delia Pop, Dr. Rinchan Chopel himself, and several other experts. So these conversations deepen our understanding of care systems and inspire reform. Beyond academia, ICB also fosters community engagement to co-create solutions. We've released a podcast, which is a series of 5 episodes featuring internationally distinguished personalities who possess remarkable expertise and experience in the field of family strengthening and alternative care, and they have been associated with the journal in some capacity. Now looking at some of the trends and recommendations from several papers which have been published in this journal. From 2014 to 2024, we've seen a shift from institutional care to family-based models, with evolution of policies, refined guidelines, and advocacy. Some of the key trends include challenges in kinship care, which also showcased financial constraints, lack of access to support services, the COVID-19's impact on the care system, improved psychosocial outcomes of the family-based alternative care, use of digital tools for care management and child tracking, leading to timely intervention and reduced vulnerabilities. Some of the recommendations also included simplifying the assessments, making data open source and uniform, unite global agendas through inclusive campaigns, taking into context the cultural context, prioritize relational and transformational change. So the evidence undergoes the need for systemic changes, community involvement, and policy reforms to effectively inform and support care models. Next slide, please. So the first issue of the journal was launched with the first BICON in 2014, and here we are with the launch of our 24th issue of the journal at the 6th BICON. So as Dr. Monisha Nair Akhtar, our editor-in-chief, says, we are only as good as people who support us and believe in the efforts to make this a better world for children. So here we are. Let's continue to build evidence, amplify the voices, and drive change together. Thank you.
Thank you, Gurneet. We are running behind time. So I just conclude the session, and we have a very brief, one more 10 minutes time for our journal launch. So before that, yes, thank you so much to all the panel members. to exploring how evidence is not just about number, it's about stories, systems, and sustainability. It's the foundation of reform and accountability. So with this, and now it's our great pride to announce the launch of the latest issue of the ICB Journal, dedicated to family strengthening right here. I think Gurneet just mentioned about that also, where conversation on care reform are shaping the future of child protection across Asia and beyond. The issue, guest edited by Martin James Foundation, spotlights what possible when research meets frontline practices and when families are truly placed at the heart of care system. As we move forward, may this issue inspire collaboration, compassion, and change, reimagining care not just as protection, but as connection, dignity, and hope. So now for the journal special issue launch, I cordially invite Dr. Ranjan Chopal, one of the interviews of the journal, who had also launched its first issue at the first BICON. Dr. Kiran Modi, licensing editor of the journal. Mr. Emmanuel Haq, one of the editor board member of the journal. Ms. Diksha Thapa, one of the author of the journal, and the panel member present here. Yeah.